And welcome to the news today on YHC. We're going to get started with a special guest we have with us today. We have Dr. Chad White of Missouri Southern Healthcare. And Dr. White, welcome back.
Hi, good to be here.
Sure. And you're here to talk about the screening that's taking place, the free skin screening taking place in Bloomfield this Thursday. And it's in cooperation with Missouri Southern Healthcare, putting this on yourself, Dr. Gurpreet Boparai, which we had on last week to talk about this, and Amy Holland, family nurse practitioner, will be providing the screenings this Thursday.
Yes. Let's see, where to begin with the skin cancers. There's a lot of them. Most common, squamous cell, basal cells, melanoma is the bad one. Most of them are benign, slower growing, except for melanoma. That's a bad one. When you got that one, you got to take action pretty quick. Sun exposure increases the risk of all of them. We're going to be doing that screening, like you mentioned, in a couple of days to kind of help create some awareness of the community and kind of help people make people aware of sun exposure and the risks. What we do is, as doctors, we do a lot of counseling, a lot of teaching. Try to get people to avoid the sun as much as possible anyways. The risk factors for skin cancer, fair skin, more sun exposure when you're a youth, so we do try to get our patients to keep the sunscreen on their kids, especially if they have fair complected kids. That certainly makes a difference. The different types of skin cancers, there is the squamous cell and basal cells. You typically see those on sun exposed areas of the body. People that don't get a lot of sun exposure typically don't get them, but they are cancerous and they do need to be removed. Let's see, actinic keratosis we see a lot of, especially with farmers, people that are out in the sun a lot. Actinic keratosis is a precancerous condition. Typically develops as a rash or kind of a rough patch, typically on the temples or on the ears. And it'll come on for a few weeks or so. People put a lot of lotion on it thinking it's some dry skin, and then it goes away, so they think the lotion cured it when really it would have went away on its own anyways. And then it comes back a few weeks to a few months later and then resolves again, but eventually it comes back and stays back and then tends to turn into skin cancer. And that's sun exposure is what causes that. Let's see, with the sun exposure, it is a UVA, UVB. UVB is considered the most harmful. It's in the sun. The tanning beds, they use a UVA radiation, which they say it supposedly decreases the risk of skin cancer, but the studies do show that it does significantly increase the risk of skin cancer as well. So basically tanning beds are bad and we shouldn't use them. Let's see, with the skin cancers, how do you know if something's malignant or if it's growing or if it's just a benign mole? We look at how much it's changing. If it's if you've had the same lesion there for years and hasn't caused any problems, hasn't changed, it's not ulcerating, it's not increasing in size, it's not bleeding, then that usually means it's typically benign. We also look at some other characteristics too, such as if it tends to be stuck on the skin, like a piece of chewed up bubble gum. If you stick it on your skin and it looks like it's, you could just pull it off, that typically means it's benign as well, as opposed to if it's kind of grown into the skin. That's a little bit worse of a sign as well. I don't know, anything else, any questions?
Who are those that are most at risk?
Most risk, the fairer complected, the more at risk you are. The more sun exposure you've had as a youth, as a toddler, then that does increase your risk significantly when you get into adulthood. The UVA, UVB rays do damage the DNA. Sometimes it takes years for that to develop into a cancer, but it certainly can. And so the younger you are, the more risk you are. Of course, the more sun exposure you have, the more risk you are as well.
Okay, that makes sense. And this is taking place this Thursday from 3 to 5 at the Bloomfield, the Stoddard County Public Health Center. It's in Bloomfield, and Missouri Southern Healthcare is working in cooperation with the health center and providing these free free skin screenings. And you do have to make an appointment. Give them a call there at 573-568-4593 and just make an appointment. Between 3 and 5 o'clock, they'll set you up, get you looked over, and provide a very necessary screening, a skin screening. And we've had you on, and other doctors with MSH come on and talk about different different cancers.
Yes,
when
exactly.
it comes to
Yes.
the various ones out there. So
Exactly.
this is one as well.
You know, one thing that people tend to not think about is the eye damage that comes from the sun as well. You can get pterygiums. That's more common in warmer climates. The farther south you go, the closer to the equator you go, you can actually get these pterygiums on the eye, triangular yellowish tissue that can kind of go over and encroach in your pupil and block your vision as well. Typically, they don't get into the pupil, but when they do, then it does cause problems, and that's a sun exposure issue as well. So wear sunglasses also. It's
Right.
important.
Sure, and sun can be dangerous.
Yes.
It's a big beast up there. So again, the free skin screenings are taking place Thursday from 3 to 5 at the Stoddard County Public Health Center in Bloomfield. MSH doctors, Dr. Chad White with us here, also Dr. Gurpreet Boparai and Amy Holland, family nurse practitioner, will be on hand to provide the screening. So very important, very necessary, and it's free. So give them a call, sign up, and get an appointment for Thursday. Dr. White, it's good to have you on again with us.
All right, good to be here.
Talk with you again, and you're welcome back anytime in the future.
Okay, excellent. Thank you very
All
much.
right. Dr. Chad White of Missouri Southern Healthcare. And we'll be back.